Namaskar, everybody. My name is Dr. Anil Mattu. I am a pulmonary and critical care specialist here in the United States. And my friends and my relatives had told me in the past to send a message to our community and other individuals at large, but I had been hesitant all this while. But after the recent crisis that occurred, I thought I should at least share my information with you, because over the last 13 months, I have practically dealt with this almost on a daily basis, both in my clinic, in the hospital, and in the intensive care unit. So I would like to share this information, and I would like you to adhere to these guidelines. It will save you, and it will save your family members and friends. Okay? And I have written 20 points, and I'll go over them one by one. Point number 1, you will not catch COVID unless you go looking for it. Number 2, remember, you will catch COVID from the person that you least suspect. Invariably, it will be a family member or a close friend, because you let your guard down. Number 3, the single most important armament in the prevention of COVID is the mask. Not a cloth mask, but a surgical mask. It is also important to wear the mask in a proper manner over the bridge of your nose and not under the nose, and secure it around the bridge of the nose and underneath your chin. Number 4, if you or any of your family member acquires COVID, immediately isolate him in a separate room. If you share the same room with the infected person, you will catch COVID, even if you wear the surgical mask. Number 5, assess the individual's risk factors. The biggest risk factors are obesity, diabetes, and compromised lung function, whether it's COPD or pulmonary fibrosis. Number 6, if you do not have any risk factors, there is a greater than 85% chance that you will have mild COVID, and no intervention will be required except boosting your immune system with vitamins and light exercise. It is important to be up and about and do deep breathing exercises. Number 7, while you are sick, monitor your oxygen saturation with a pulse oximeter every 2 to 4 hours. If your oxygen saturation is greater than 94%, there is no need to panic. Number 8, in the meantime, other family members need to take strict precautions so that they do not catch the infection from the sick person. Number 9, family members should not enter the sick patient's room without an N95 mask and a surgical mask on top of it and an eye shield. Extremely important. Do not enter the patient's room with just a surgical mask. If you do that, you will catch COVID. Number 10, if your oxygen saturation remains more than 94% and your fever has settled down by day 8 or day 9, you will be just fine. Do not panic. Number 10, if you are a high-risk individual or you're a normal risk individual and your fever is not subsiding, and your fever and your oxygen saturation has started dipping below 94% on a persistent basis, you will need to collect more information, including blood work like CBC with differential, CRP level, D-dimer level, liver function tests, and your electrolytes, including kidney function. You should also get a chest X-ray. If you can get a CAT scan, that would be preferable. Number 12, You should, in the meantime, also mobilize your support group in case your condition deteriorates. Number 14. If you continue to deteriorate with your oxygen saturations persistently below 92%, you need expert opinion to start a treatment plan right away. Number 15. Do not just stay at home that things will get better. The most important point at this stage is to be proactive and have early intervention, either supervised at home by a physician or preferably in the hospital if you can find a bed. Number 16. Once you have moderate to severe COVID, the most important interventions are, number 1, oxygen if your oxygen saturation is less than 90% on room air or on minimal exertion. So you're just going from the bed to the bathroom and your oxygen level drops, even though you may be 91, 92% on room air, you need oxygen. Number 2, steroids, either IV or PO, depending upon the patient's condition and the disease burden. Number 3, anticoagulants, depending on an individual case based on their D-dimer levels. Number 17, costly medications like remdesivir or tocilizumab are not magic potions, but they have a role when used appropriately in a timely manner. That's the most important factor. Number 18, the longer you take to get expert opinion, the less effective these interventions will be. Number 19, there are 2 basic mechanisms by which patients get sick. Number 1, inflammation followed by scarring, and number 2, development of blood clots. Point number 20. So if you wait too long and the process of inflammation leads to fibrosis or scarring of the lungs, these interventions will not reverse the process. So act early if you have moderate to severe COVID infection. Thank you. I hope these points were useful to you. Kashmiri Overseas Association has developed a task force to help our brothers and sisters in India. Please reach out to them or your local community leaders, and they will put you in touch with experts who can guide you through this process. I wish you all the best. May God bless you.